Thank you, everybody, to be here. Welcome to all the audience from all over the world. It is really a great pleasure to be here with you all from all the colleagues from all over the world, despite all travel bans for the particular period. I wanted to thank very much Fillmed company because organized this wonderful webinar. And in this webinar, we will have a truly global discussion on beauty from different ethnicities. And for this, we have connected 4 great speakers from different countries and from all over the world, connecting Latin America and the Far East, from Africa to Europe, where I am. So thanks to Dr. Lam from Singapore. Bilan, how are you? How is the situation in Singapore?
Hi, Lizio. Hi, Ricky. Singapore, the COVID-19 situation is now under control. We are fully operational, the aesthetic clinic, since 19th of June. Thankfully, since we reopened, business has been pretty stable. Although we can see patients being a bit more selective in aesthetic treatments because people are losing their jobs and getting pay cut. But still, they want to look good. They want to look presentable. So hopefully with that, things will continue to be good and the COVID-19 situation will be over very soon and we'll all meet face to face, hopefully next year.
Thank you so much. Thank you so much. Now, I know that there are little problems with Ingrid Lopez-Gerke, that is probably not here yet. Ingrid? No, but we have anyway connected from South Africa, my very good friend of mine, Ricky, beautiful and very expert aesthetic doctor, and a very good mother of 3 incredible children. Ricky, how are you?
Hi, Alessio. Very good, thank you, and welcome to everybody. So South Africa is going into summer. We are over our peak and everything looks good. So I hope to welcome all of you again very quickly in South Africa. A very good time now. We have a very long summer, so hopefully it's very good for the whole situation also.
Very good. Thank you, Ricky, to be here with us. And I am connected, as many of you know already, from Milan, Italy, Europe. I ask for your understanding up front, since everything is totally live. We didn't want to register anything before, and so few little imperfections are part of the game. And I suggest you, if you want to post your questions, to go on the chat that you have here in Zoom and post your questions immediately, because then you maybe forget. And from our control room, they will give me the questions and we will try to answer you immediately. So now from Singapore, Lambilan will start with Asian beauty. Bilan, the stage is yours. Thank you.
Hi, everyone. I'm Dr. Lambilan from Singapore. I've been practicing medicine for more than 2 decades, in aesthetic medicine for 16 years. I would like again to thank Fillmed for inviting me here today to share with you the Asian concepts of beauty and also Asian patients' demands in aesthetic treatments. Now, before I begin, I would like to share that I've still no experience in the use of the excellent products from Fillmed, but I certainly look forward to using them on my patients, especially the Skin Bio Revitalization product, NCTF135HA. I'm going to walk through with you the following contents: what is beauty, what constitutes an attractive Asian face, very briefly anatomy, areas of demands of Asian patients in aesthetic treatments, and conclusion. Now, we know the definition and standard of beauty is different in different culture. What is beautiful in one culture might be considered ugly in another. For example, the high cheekbone and subzygomatic hollowness that we see here, and that's highly sought after in the Western culture, in Angelina Jolie, it's actually highly undesirable in the Asian context because this signifies sickness and poverty in Asian women. Now, Asian women prefers the wide eye look with facial chubbiness or fullness, and Asian women particularly like the dewy, porcelain-looking skin that we see in this very famous Chinese actress, Fan Bingbing, and also they like a V-shaped face because all these features signifies beauty, innocence, youth, and a good sign of good fortune for the husband. Now, an oval-shaped face we know is highly desirable across all races and cultures. Now, although beauty is universal, as an aesthetic position, we need to understand that every ethnic group has its aesthetically weak and strong points. Now, generally speaking, the most beautiful and attractive people of each and all races tend to look similar in the facial shape. They all prefer an oval facial shape, facial features. They have harmony, balance, and symmetry in their faces. So what constitutes an attractive Asian or Chinese face? Now, attractive Chinese women have smaller bizygomatic and bigonial width and a slightly greater temporal width so that they have a V-shaped face. They also have smaller facial heights, smaller ratio for upper facial heights, lower facial height to the total facial heights, by a slightly increase in ratio of the middle facial height as compared to the total facial height. In other words, attractive Asian women have a slightly larger middle facial height as compared to the upper and lower facial height, and they also have oval and triangular shape of their faces. Now, what happens as faces become less attractive? As faces become less attractive, they tend to display more distinct ethnic features. This is a photo illustrating some of the morphological features of a typical or average looking Asian face. And this is courtesy of a renowned Australian plastic surgeon, Dr. Stephen Liu. As we can see here, a typical or average Asian woman has wide bitemporal, bizygomatic, bigonial width. They also have puffy upper eyelids, epicanthal folds. For the nose, they have a flat dorsum. They have a nasal tip that has less projection, a wider nasal base. There's protrusion of the piriform fossa, resulting in perioral protrusion. And many Asian women also have bimaxillary protrusion, hypoplastic mandible, giving rise to a receding chin, but not in this lady. I'll show you an example later on. They have also shorter vertical height. In profile view, a typical Asian woman also has a concave or flat medium maxilla. The lower face has a wide mandibular width, resulting in a square lower face. In other words, a typical Asian woman has a short, wide, and a very flat face. Now, conventionally, for an ideal face, okay, there's a long-lasting belief that the horizontal facial third theory, that if we divide the face into three parts, from the trichon to the glabella, from the glabella to the subnasal, from the subnasal to the menton, each third must be an equal third in an ideal face. So is this true? Professor S. Ri, who is a renowned Korean plastic surgeon, found that this does not hold true all the times these days. Okay, he found that the ratio for the three parts for attractive faces in different ethnic groups are shown in this slide, and he found that attractive women of different ethnic groups do not necessarily have equal thirds of their faces. Professor Assiri also found that in the attractive female faces of both the Asians and the Caucasian ladies, the mid-face is longer as compared to the upper face and the lower face. And the attractive faces of both the Asians and Caucasian women have a similar proportion of their upper faces. Asian women, as I've mentioned, preferred slimmer or smaller jaws and a V-shaped face, and the lower face of the Asian female is slightly shorter than that of an Asian male. I'm going to walk through with you very briefly the anatomy. Okay, now we can see here, this is an illustration courtesy of a renowned Korean anatomist, Professor H.J. Kim, comparing the skulls of Asian to Caucasians, we can see that the Asian skull is wider overall, wider bitemporal, bizygomatic, and bigonial width of the temporal, the zygoma and mandible, respectively, compared to that of a Caucasian skull. The skull is also shorter in vertical height. On the profile view, the Asian skull has less anterior projection with a more protruded frontal bone and supraorbital ridge, recessed nasion, infraorbital rim, medial maxilla, maxillary process of the zygoma, anterior nasal spine. In other words, the Asian skull is generally flatter, more concave or retruded in the midline as compared to the Caucasian skull. Next, I will share with you a very interesting Chinese belief which very often influence aesthetic treatments in Asian women. Now, this is a practice of face reading. The practice of face reading is an ancient art known around the world, and in Mandarin, it is known as feng shui. Chinese face reading dates back thousands of years in ancient times, and it has its roots deep in Chinese cultural beliefs. So what is the facial reading? The Chinese face reading. Now, each part of the face, as can be seen here, represents different facets of fortune or misfortune and the fate of the person. Apparently, an experienced face reader can tell a person's past, current, and future luck, the different facets of his fortune and his fate, just by examining the face. For example, you can see here the forehead represents career and fortune, life palace is the glabella, marriage is in the temple, the lower eyelids are children, the nasal bridge is health, wealth is the nasal tip and the nostrils. The Chinese believe that if your nostrils are wide, flaring, especially if exposed anteriorly, you will lose a lot of wealth through your nostrils. Okay, the lips represents willpower, and the chin represents supportive friends and subordinates. Now, let me walk you through this very interesting slides, okay, to see what it means. For the forehead and glabella, the Chinese believe that if your forehead is wide, round, shining, and smooth, it represents your good family inheritance, you have a comfortable upbringing, you have a good career, good fortune, and you lead a trouble-free life. Now, any flaws in the forehead brings bad health, distressful relationships, or money troubles. And receded, dimple, or lines in the glabella means the person suffers hardships, hindrance, hard times in his career and marriage. How about the temple? Okay, now full and smooth temples are highly desirable for the Asian women because they represent you have a good marriage. A receded house in the temples means extramarital affairs. Any visible scars, black moles, spots, and messy lines in the temple may give rise to serious trouble in marriage. And sunken temples means you have inharmonious marriage. Now, all these, of course, means that the Chinese believe these in their Chinese culture, and most Asians therefore prefer a smooth forehead and glabella and full temples without any hollows. And therefore, forehead, glabella, and temple augmentation with dermal fillers is a highly sought after treatment in many Asian women. And very interestingly, even if the Asian women step into the clinic of an Asian physician, not seeking these treatments, it is very easy for us to convince them to do these treatments because of these deep-rooted ancient Chinese beliefs. Now, in a survey conducted by the American Society of Dermatologic Surgery in 2015, data was collected from 7,315 consumers through a blind survey. It is found that 72% of consumers are concerned about the skin texture and or discoloration of their face, and this is much more than the 55% concerned about wrinkles between their eyebrows and 69% concerned about wrinkles around their eyes. Okay, now in another study conducted in 2019 by the same society, where data is collected from 3,645 consumers, again through a blind survey, And overwhelmingly, 71% of consumers, again, are concerned about skin texture and discoloration. Now, according to a paper on the consensus of changing trends, attitudes, and concepts of Asian beauty, published in the Journal of Aesthetic Plastic Surgery in 2015, the aims of facial aesthetic treatment in Asians are to achieve a clear, youthful, and fair skin, overall facial shape with smooth facial contours, and aesthetically pleasing structural definition of the nose, the chin, the eyebrows, and the cheeks. Now here, NCTF 135HA injections are an excellent choice for skin bio-revitalization to give clear, youthful, and fair skin. And as I've mentioned earlier, I certainly look forward to using these in my clinic. So what are the common treatment areas for facial injectables in Asians? It includes nasal augmentation, medial cheek and chin augmentation with dermal fillers, and neuromodulators for masseter muscles hypertrophy to reduce the lower facial width. Now, when it comes to the areas of demands in terms of facial volumization with HA dermal fillers in Asian patients, which are these areas? Let me walk you through. Now, as mentioned earlier, Asian women tend to have midline structural deficiencies characterized by a flat or concave forehead, a flat nose bridge and nasal tip, medial malar deficiencies, mandibular hyperplasia with deep piriform recess, and a receding chin. Now, Asian aesthetic physicians commonly use HA fillers to reshape and recontour these facial deficiencies. We do this by adding fillers to the medial malar region and the subzygomatic hollowness to medialize the apex of the cheek, giving the illusion of a narrower face. We generally do not add fillers to the zygoma, unlike in the treatment of Caucasian women, as this will further widen the already wide mid-face. HA fillers are also used to volumize the forehead and glabella, the temples, to create an aesthetically pleasing, convex, and youthful contour of the forehead, glabella, and the temples. Now, anterior projection of the nose, elongation of the chin, and anterior projection of the chin with dermal fillers will also help to bring the whole face into harmony to create aesthetically pleasing results. Now, all these will create a visual illusion of adding volume to the face to narrow the whole face. As mentioned earlier, Asian women also love to possess dewy, hydrated, porcelain-looking skin, and therefore skin bio-revitalization products are highly sought after in this part of the world. Now, what about the males? What constitutes an ideal or attractive Asian male face? Male attractiveness requires strong facial definition, which includes a facial proportion of 1:1:1, a flat forehead, lower brow position with a flatter arc, a strong nose, nasal tip pointing anteriorly with a nasolabial angle of 90 to 95 degrees, well-defined strong jawline, a strong box-like chin, and male lips should maintain a neutral position, not to create them in upturned position, because this will create a joker smile, which is not aesthetically pleasing to the eyes. And we should also avoid volumizing the upper lips. So in the male, Asian male, HA fillers are added to masculinize the look by augmenting their zygoma, their nose, their chin, and the jawline. However, with the rise in popularity of the Korean K-pop culture, our men these days are getting increasingly feminized. It is therefore important for us to understand our patient's job and personality in order to prescribe the right aesthetic treatments that match their needs, their personality. In conclusion, although beauty is universal, as aesthetic physicians, we need to understand that every ethnic group has its aesthetically strong and weak points. Now, understanding the needs and demands of our patients and tailoring and individualizing the treatments for each patient with the right products will help us achieve aesthetically pleasing results for our patients. With that, I thank you.
Thank you. Thank you so much, Bilan, it was great. I have a question from the audience before running to next speaker. And the colleague would want to know which technique and which material do you prefer for the cheeks?
The cheeks?
Yeah.
Well, it depends on the, as I've mentioned earlier, Prof, I don't have experience in Fillmed products, but for the media mala region, generally depending on the patient's face, for Asian patients with very flat nose bridge, if the nose bridge is very flat, we do not want to raise the cheeks higher than the nose bridge. You will look like an avatar. So generally speaking, if the nose is very flat, we only want to make the cheek lower than the height of the nose. And depending on the volume loss, if it is a younger patients that need to only give the patients a contour, we may want to use a filler that is not so, that doesn't have so much high G prime. But in older patients, there's a lot of volume loss, and we need a product with higher G prime to actually give it more anterior projection of the cheek, especially if the patient has a very high nose bridge, then we'll use a product with higher G prime. So again, it depends on what we see in the patients, and that's why we keep saying as a aesthetic physician, as an injector, it is very important for us to understand, to individualize the treatment to every patient, looking at the whole facial structures, and then the skin quality, depending on that, then we'll prescribe the right fillers for the right treatment.
Thank you. Thank you so much. Then we will have time for other questions that in the meantime are arriving. I remember all the colleagues connected that they can post their questions on the chat, and then I will be able to ask all the speakers. And now I know that Ingrid Lopez Gerke from Mexico City and from Mexico is arrived with us, and so I ask Ingrid to take the stage to introduce the Latin America beauty and all the little details.
Can you hear me? Hello?
Very good, very good. You can go on.
Okay. As you all know, ethnicity is really more than a tradition, is more than a language. So it's really a strong connection between people. So I want to start saying thank you, and because I'm really happy to be here with you to share a little bit about my experience in Latin American patients. And of course, we want to talk about, or a little bit about proportions, patients' demand, and way of correction. And before start to talk about Latin America, we need to remember that we are talking about more than 20 countries. In North America, only Mexico, but then Central America and South America and Caribbean. So we are more than 20 countries. Our specific or predominant language is of course Spanish, but also Portuguese. And we are talking about more than 600 million people. So that's why I want to start sharing to you this slide. Here is a report, an overview about the cosmetic procedures. In 2018, the International Society of Aesthetic Plastic Surgery shared with us these numbers. And here is very interesting because they said they reported in 2018 an increase around 5%. But if you see the letters in blue, we can see that it depends on in the non-injectable treatment. So this is really important. And if we see by country, if we analyze this, we can see here all the treatments, and we can see that the number one is of course USA, but then we can see how important is, for example, Brazil or Mexico, and also Argentina and Colombia are really important in this specific treatments. So we can see here the same thing in injectables. The second place is Brazil, but in the top 5, Mexico, and also very important, Argentina, Colombia. And if we analyze, for example, the hyaluronic acid, very specific, so we can see the same thing. And the market is growing very, very fast. So that's why it's very important to say beauty in Latin America. I need to say that the concept of beauty has changed in recent years. We now have recognized and accepted our authenticity and peculiarities, and these things we can see very, very easy in the magazines. For example, this is a Vogue magazine, and we can see the typical Mexican beauty. And for example, if we read what they said, it's really interesting. The moment came when we just look at each other in silence. We admire the beauty of each of the women who are around us day by day, so we can finally celebrate and value our true identity. So this is really interesting, and we can see this tendency in all the covers of the magazines here in Mexico and around the Latin America. For example, we can see here a very young woman famous because she is a long running distance, or for example, a typical Mexican actress, and so on. We can see, for example, different styles of Mexican beauty representing Latin America around the world. So that's why, for example, she's Lali Esposito from Argentinian, and in the same way that the concept of beauty has been transformed in recent years, also the demands and needs of our patients are changed. So that's the same thing that I explained before. People are now thinking in prevention. They don't want to go to surgery too soon. So all the tendency in all this kind of treatment is really important. But they are looking not only, for example, for injectables, they are also looking about prevention. So for example, in Latin America, it's really important, the skin quality. So that's why all our treatments are very important. For example, if we see the key points, of course, the first thing is the natural results in Latin America. The cost level is important, so the low budget is an important thing. But if you see, here we can see that more than 75% of women are looking for natural results, but also they are looking for a really homogeneous color of their skin, the tonicity of the skin, the size of the pores. So all these kind of things are really important for us. When we want to try our patients, we always need to remember that it's important to analyze the aging curve, not only the age. We need to exactly know where we want to treat our patient. So this is an important thing, but also to remember, I always like to say about that, to remember the difference between male and females. So here we can see from the woman or for the female, and that's the same thing when we look the profiles. So here we can see typical Mexican young people, so very nice. The difference, we can see more square for the men and more rounded, more ovoid the face, the features for the female. So it's also very important to remember those kind of things. Of course, we have a lot of patients with these mesocephalic proportions, or really good proportions, but we also have very often, or we see very often, brachycephalic or dolichocephalic faces. So we can see here, for example, a brachycephalic typical phenotype. This is typical face of woman from central part of Mexico, but not only Mexico, it's also Latin America, the south part, for example, Bolivia, Peru. So we can see that this axis, the face is very, very width. So we need to remember that. In those cases, brachycephalic patients don't need lateral volume, so we need to be careful with that because they need anterior projection in most of the cases. And in the other sides, we can see, for example, here the oligocephalic phenotypes. So this is very typical from men in the central part of Mexico and also Latin America in general, so it's very important. Here, for example, we can see he's very famous. He is from Puerto Rico and he's a singer. He's very, very famous, and we can see that dolichocephalic patients usually needs lateral volume to simulate a shorter face. So always we need to personalize our treatments to analyze what we can do. And that's really nice to have all these protocols, because I think with all the Fillmed products, we can do whatever we want. So for example, I want to show you here one video. So is, for example, I'm using here a volume. I like to combine this kind of techniques. Here I'm applying in one shot in the temple, one shot technique. I'm applying about 0.3, 0.5 milliliters in one shot technique. So for the upper part of the temple, if you see, the volume product is really, really amazing for the temple. I like to use it very, very much. And I like to combine with this kind of technique, because the lower part of the temple, we always need to remember that we need to be safer as possible. So I like to be in the layer number 4, so that's under the fascia. So, or in some cases we can say interfascia treatment. So I apply most of the cases 0.6, 0.7 in this part of the treatment, and I like to use it very, very often with Fillmed products, because it's really, really, the rheology of this kind of product is amazing. So here we can see, for example, the before and after. She is 50 years old, but she said to me that she is looking older, but not only older, is the problem is that she was more masculine with the years. So that's why we decide to treat all the face. Of course, we are seeing here a full face treatment, but if you see, the forehead is really, really a difference, and the temple area is also a very important difference. So because we are applying universal in this case with a fan technique in the forehead, and I show you my technique for this kind of temples. So in the lateral view, so here in the profile, we can see really the difference between the before and after. So she's looking younger, but also more feminine. I want to show you also, for example, a technique with universal for the cheeks. In some cases, I like to use volume for these kind of treatments, but as I explained, in Latin America, our patients, they have really, really good cheekbones, so we need to be careful not to give a lot of volume in the lateral part. So that's why I really like to use universal in young people with this kind of technique, because it's really, really nice, the results, very, very natural, and for me is one of my favorite treatments. So we can give more light, we can enhance the face, so it's really, really nice. I want to show you really quickly another technique. Is the same kind of technique to give lateral projection, but not with a lot of volume. So it's really with I am applying a lot of not a lot of volume. For example, 0.2, 0.3 in each point. So it's really, really a nice result. So for example, I'm using also these kind of protocols in our patients because they want also natural results in lips. For example, they don't want to have very big lips. So I really like Lipsoft art filler because as you see, we can have really nice results, very, very beautiful for our patients in Latin America. So I like it very, very much. And of course, I explained that for us, the skin quality treatments are very important. So not only for the tear trough, for all the face, I really use everyday NCTF because it's for me the best one to enhance the skin quality. So with all of these, we can have prevention with all these protocols, of course, beautification, correction, we can do whatever we want. So that this is why I love all the protocols from Fillmed. So here I want to show you, she's a young woman. She wanted to treat only the tear trough, but I said that we need also to have more skin quality. So we decided also to treat with NCTF. And as you can see the difference between the before and after photos. So very, very nice results, very natural. And also we can see the difference in the skin quality. So our patients are looking of those kind of results. So here we can see the same thing, the before and after, not only the tear trough, is also a whole treatment with natural results. So I want to conclude that in Latin America, we need to say that it's really an important market for injectables. We need to remember that we have special features, special characteristics, and in some cases we need to have special approaches. So for example, I explained, we don't use to apply a lot of lateral volume in some of our patients. So also the skin quality is a really big concern in Latin America, so be careful with that. And to end, I want to show you that we need to analyze and be very specific, because we have in Latin America different kind of looks and also personalities. So we can see people who want a lot of volume, but we have a lot of people who are looking for natural results without scars, seamless results. So this is important always to remember. So I want to thank you, and that's all what I want to share today with you.
Thank you so much, Ingrid. It was a great presentation. I have a question from the audience that asks you when you treat the zygomas, when you choose universal and when you prefer to choose volume according to the projection, the different kind of patients. Which is your suggestion for our doctors?
Yes, I explained in some cases we have a lot of patients. So the typical native patients, they have really big cheekbones. I always analyze this, the lateral projection and the anterior projection. And if we have really big cheekbones, so I apply universal for the lateral part, and in some cases volume for the anterior projection. If we, for example, have more Caucasian faces, we can apply with volume in this part of the face, because this is a big difference between the native phenotypes and the more Caucasian patients.
Very good, very good, and very quick, very short, because we have to fly to another continent of the world. Which technique for soft lips, needle or cannula?
I always treat my patients with cannula, because for me it's more safer, and the swelling is really different at the next day. So I can sleep very, very good at night when I tried my patients with the cannula. So I need to say that in most of my cases, I treat my patients' lips with cannula. Only when I want to define really, really nice, so I use the needle. If not, I prefer the cannula. I need to say that.
Of course, I have to underline that there is an unlabeled technique, and of course, Fillmed doesn't support the use of cannula, and this is your experience, and also my experience, that also I use for my experience the cannula many times.
Yes, I said it's my personal opinion, but yes, for me it's really nice to use the cannula. So very, very, for the lips, I use 25, or in some patients with very thin skin, I use 27. cannula.
I have very quickly another question. Hello, Dr. Ingrid from Panama. Do you always treat first chicks and malaria before treating tear throat?
Yes.
1 minute.
Yes, yes, of course. That's all. I always said that it's really, really important to treat the midface first. But I mean the cheekbone, so the cheeks, the anterior protection, the lateral protection first, and then after that the tear trough.
Very good. Thank you so much, and thank you to all the colleagues for the questions. And now we fly from Mexico. Ciao, Ingrid. Thank you, but remain with us, of course. We fly to South Africa in Pretoria, where Ricky Smith will say us her experience in African patients. Ciao, Ricky.
Oh, Alicia, and to everybody, hello. So it's a wonderful summer's afternoon in South Africa. 3 o'clock, or well, almost 4 o'clock here, and everything is really going much better in our country, and I hope also in your countries. So I'm going to talk about my experience with South African patients, and particularly focusing on African patients. And we know that the proportions and demands are very different, as we've seen from all the different countries. And it's really individualized, as also Dr. Lan said. We need to individualize and look at each patient and their needs, their personalities, their careers, and everything. Now, the African faces, there's also a lot of different African faces in different North Africa, West Africa. In South Africa itself, we've got so many different cultures also. We've got 11 official languages, just to tell you also. But I think there's quite a lot in general that we see from the typical African faces. And to make it more simple and for the time, I'm going to focus mostly on the female African face. Now, if we look at a beautiful African face, a study actually looked at the ideal proportions and how it applies to African models, so really famous African models. And if we look at the Leonardo da Vinci proportions that Alessia will also explain a bit more, only one of the 12 golden facial proportions was similar to that of the Caucasians. So making you realize that we need to look at them differently and look at what is beauty differently in each one of the continents and the different patients. So looking at the typical African females, so we can see in the width of the face, the facial width is usually wider. The nasal width is usually wider than the intercanthal width. In the length, we also have quite a few differences. Now, Dr. Lan also explained already the different thirds in the different cultures, but typically in an African face, the medial third is the shortest, and the forehead being usually the highest one, so much bigger in that. And the lower third is often much shorter also in that. On the side profile is actually where we see the biggest difference, especially compared to Caucasian faces. Now, we all know the Ricketts E-plane. It's a very nice plane to use to see the proportion of the nose, the lips, and the chin. And it's very common and very beautiful that in African females that the lips actually crosses the chin, the line, so giving you almost like a kissing format, and also a very projected face. If we look at the facial angle, the glabellar nasal pagonian angle, it's a more protruded face. So it's not typically we see mid-face flat, but the lower face being very much protruding. And then we know obviously the nasal frontal angle is also larger with a flatter type of nose bridge. And these doesn't really mean it's not attractive. It's attractive actually and suits their face, and this we need to respect. So looking in general at all the different types of cultures and all the different African patients in general, what is it that they demand from treatments? Now, first of all, pigmentation disorders is a really big thing. So they've got a very high risk for post-inflammatory hyperpigmentation, melasma, scarring type of things, a lot of skin disorders. The mid-face volume loss is very important also, especially nasolabial. And also there we need to realize in most of the African patients, if they have a fuller face and also fuller body, it means that their husbands are really looking well after them. So an emaciated face is not a good sign, especially for the marriage and for how the husband is treating the wife. So a fuller face is also more desirable, as we've seen also with the Asian faces. And then lower face laxity really shows that they are not being looked after, they're not healthy. So that's also very important. Then a very big concern is traction alopecia. So often they would come to you for facial concerns, but the hair is really a big problem because of all the braiding and weaving. And very easily we can combine it with our facial treatments. Then we also have specific concerns such as acne scars, keloid scars, nose and chin enhancement. Neck wrinkles is very common from a young age already. Then also hair removal and buttocks is also a very big thing. They really like the typical Latin American also, but very commonly a fuller buttock is very important as opposed to Caucasian looks. So the most important concerns that we really see in the African patients is skin, the pigmentation, volumes, it would be mid-face volume loss, and I must say most of them always come and ask about nasolabial fillers. The nose can be very specific, what they want to do with the nose, and then often it would also lead to a conversation on what can I do about my alopecia. So I looked at typically what most of my patients, so these are all patients that I've treated, and what I typically suggest for them to think about in a planning, because a plan for the patient is really important. So at least once a year, they have to come for the 2.4 full face protocol, which I will explain now. Buy Nutrilift if they're a little bit older and starting with cheek lines or sagging or maybe hollowness. Nanosoft is really popular. So NCTF, they love to do it, especially for dark circles underneath the eyes. I'll also then do the hairline when I do the whole face, the neck, and then for the horizontal necklines. Bright Peel, I have amazing results on Bright Peel in the darker skin patients. And then at home to use the beautiful Skin Perfusion products, especially the Bright Booster, that I have very good results with. So this is a patient that I've treated with this typical protocol. A very beautiful African patient. We can see the beautiful fullness of the lips, and very quickly just showing the Bright Peel treatment. It's very good for them because it gives that radiant glowing skin and treats the pigmentation aspects. I'm not going to go into detail of the procedure. Nanosoft is really very popular because it's not painful. They never leave bruises, very tolerable. I even do the hairline with the Nanosoft, but especially the lower eyelid on the lips for hydration, because they don't often come for fillers of the lips. It's not so common, but often just to get that small little wrinkles. And then definitely to do the neckline area is very important with a Nanosoft treatment. And here we can see a patient before and immediately after. I'll show you because I took a picture this morning, also a week later. So I did the 2.4 full face protocol for the dark circle, the nasolabial, and a little bit in the marionette fold. And the 2.4 full face protocol is a protocol to correct the shadows and depressions. And you will also find a dedicated webinar on the Fillmed.com website. So here you can see I'm using a universal in this patient. I use a cannula specifically because of the safety around there, but it can also be done with a needle technique, as you can see from many of the training webinars. And this is really focused. You will see I go specifically into the nasolabial fold, filling up the nasolabial fold from the same entry point, then moving up to the tear trough area. And obviously you need to know a lot of detail about tear trough filling. And then from the same type of entry point, then moving downwards to the marionette folds. And this is a really nice effect, especially for that mid-face volume loss that we typically see. So everything done in one treatment, the Bright Peel Nanosoft, 2.4 full face, and then the home care that gives good results. And this is my patient 5 days after the procedure. They look so much fresher, healthier. You can see the hair is different because they really love to change the hairstyles a lot. Okay, so the other way that is also quite popular is to focus a lot more on the hairline. So this patient is getting a peeling treatment, and then after the peeling treatment with Bright Peel, I go on to the NCTF, but now using a meso gun because it's really not painful and you can do quite a large area of the scalp to treat the traction alopecia. And then with the same, the Ethnicity of 135 are also then move on to the face to treat the scarring, the pigmentation and brightness of the face, and then at the same time, the neckline. So all can be done in one procedure. And that's really the most common procedures. So just a little bit on the lips. So African females are really blessed with beautiful lips. They've probably got the most beautiful lips of all the cultures, really full, protruded. Lip volumization is not very common that they ask for. Sometimes it would be contouring or correcting asymmetry, or sometimes just the small little wrinkles that they want more hydration. And that's why I also use the NanoSoft. So their lips, the upper lip to lower lip is typically 1-to-1, as opposed to Caucasians that Alessia will explain. But as I said on the side profile, really a kissing type of shape. And often the chin, you also need to check if maybe you need to correct the chin. So if we look at really popular trends among all the different ethnicities, it's actually quite interesting to see that whether it's Middle East, Asian, Caucasian, they look very similar, and the lips also very similar. So full lips is definitely the trend now. And we have this wonderful lip menu from Fillmed, the Lip Soft for more natural, which is more popular if we had to treat African patients with some loss, or volumization lips, which I prefer more for chin enhancement in my African patients, and not so much that they ever really needed for the lips itself. So really the big need for them is the skin, proportions, especially the nose, the chin area, hairline can be their specific concerns. So in summary, most of the patients would come for some kind of a skin problem. They want a beautiful glowing skin. They want to treat their pigmentation. For volumes, nasal labels would often be the first request of them, but also sometimes tear troughs and marionette folds. And if you discuss with them proportions, they will also talk about the nose, the chin. Forehead also needs to be quite smooth. And the lips would be more for hydration and reducing the small wrinkles. Hair is really very important. Most of them suffer from some traction alopecia, and that's also why it's quite trendy to go natural with their hair now. And NCTF really gives a really good result for them there. So I hope it gives you a very quick summary, a very generalized summary actually of what these type of patients ask for.
Thank you, Ricky. Wonderful presentation. And I have a colleague, Jorge Moreno, that asks me to ask you. And this is also something that I wanted to ask you. Which are the exact points you use and which material if you wanted to avoid the feminilization in men, in the cheekbones?
In the cheekbones. So usually what people don't realize is that a strong zygomatic arches does not make a man look more feminine, but actually stronger. But as soon as you go more medial, then you can actually feminize the face. So going more medial enhancement, you only really do this area if they're really sunken, but we never want to make it as puffy as we do with women, because that gives a more feminine feature. And then when you do the cheeks in men, make sure you balance out with the mandibular, because the mandibular width needs to be the same as the zygomatic width to make sure that you still have that masculine face.
And since you tell me that for also this part, the tear trough area, how to avoid risks, because I know that it is a very dangerous area. How you avoid risks injecting a tear trough?
So with a tear trough, for me, the most important thing is to use a cannula. That is obviously my personal experience, because I can feel where I am in the tissues. I can feel as I go through the retaining vascular, but also even with a tear trough, you can cause some damage. Very important to realize. A cannula doesn't give you 100% safety.
So I lost a little bit. You use, for personal experience, you use mainly cannula, right?
Yes.
Perfect.
Yes.
And finally, one, because in this you are really trained. What is the concept behind NCTF for treating fractional alopecia, and can it be used for hair treatment?
Yes, so NCTF 135HA actually has studies on alopecia. It gives nourishment to the follicle. It gives all the vitamins and minerals. And I prefer the HA, NCTF 135HA. I've got much better results on traction alopecia because you also need to hydrate the area. And really, if you have an African patient, you also have to tell them to alternate between braiding and weaving and giving the hair some time to rest. But as soon as you start with the NCTF treatment, you really see new hair growth very quickly. A really good results on NCTF for alopecia.
Final, very quickly, if you have an already applied and already used, and you don't know exactly what is, how much, how long do you wait to apply another hyaluronic acid?
If you apply like a filler, cross-linked filler, and you're not sure which one, but most hyaluronic acid fillers you can do, there's not like if you use one brand, you cannot use another one on the same. I think the biggest contraindication is if a patient had a permanent filler, because then we never really want to inject on top of a permanent filler. But in my opinion, most of the patients that maybe had a different hyaluronic acid, you can apply it. Do I understand the question correctly, or you mean like a top-up?
Yeah. So there are no problems. Important is to use a well-known hyaluronic acid. So the first mistake is that the patient doesn't know which kind of hyaluronic acid was injected. Of course, we have to use very good products. Thank you, Ricky. I go on with my last presentation, and I hope that all the doctors will have the possibility. I saw that there were many questions, the possibility to post all your questions. We will take a few minutes. We are a bit late, but we will take anyway the time for the last questions. And I had the request to take care of Caucasian beauty. I live and work, as you know, in Milan, and proportions and beauty is different. You saw in Asia, you saw in Latin America, little details, little differences that should be individualized. And also in Caucasian, this is a very important marketing research. We have different kind of requests by our patients. There is the patient that is so-called the magnetic seducer, self-confident, independent, business women mainly. There are other kind of patients, pragmatic, authentic, relaxed, and another kind of patient that is strictly Medicare, wants to do everything very healthy with a very good performance. And we must know, in my opinion, which kind of patients we have, because in this way we will be able to exactly meet the patient satisfaction, patient need and patient's satisfaction. What can I say about the beauty in Caucasians? 2,000 years ago, we saw that Vitruvio told us the rules, the vertical lines, the horizontal line, that already we saw also in Asians and in all the ladies around the world. And then, as Ricky said, Leonardo da Vinci and many other very important thinkers and painters painted beauty. You see here the Botticelli Venus, and you see that also in Europe we didn't have great changes. So in French, in Italy, you see how much similar is this lady with Botticelli Venus, with the same lines and very similar, but also in other countries. In Spain, you see that this kind of beauty didn't change too much. And here you see how is strictly perfect our wonderful lady Monica Bellucci that has a perfect bizygomatic distance, the widest. A little bit less, 95% would be the temporal distance, and the bijugal distance that in the perfect kind of beauty would be 87% according to many references that I showed you. And you see immediately in this lady on the left side that something, the temples maybe are a little bit different, and so you can decide to correct it. The lips, what we can say about lips, the rules in Caucasians are very clear. The Cupid's arch, the superior lip that would be 1/3, and the inferior lip a little bit wider, 2/3. The max distance from the nasal spine to the upper lip, 1.5 to max 2 centimeters, and the distance between the lower lip and pogonion around 3.5 centimeters. And very important, the rickety line that you saw for other ethnicities, that in Caucasians is different. The lower lip normally 2 millimeters away, and the upper lip normally 4 millimeters away. According also to skeletal classes, the angles skeletal classes that can you let understand the protrusion or retrusion of the mental area and of the mandible. Here you see very well the differences that we saw in all ethnicities of the world, from Asian, from African, over the rickety line, and in Caucasian ladies, 2 millimeters, 4 millimeters, and also the difference in the shape of the lips that in Caucasians is similar to the Fibonacci number that all you know would be 1 to 1/618 of the lower lip. Finally, just to share with you the glabella, the facial angle that would be normally 170 degrees in Caucasians, sometimes a little bit more flat, or in African races, you know, a little bit more protruded, and so the angle a little bit reduced. And these are the main proportions that you can see in Caucasians. And for example, immediately you can check them in a lady that normally is thought to be one of the most beautiful ladies in Europe, and also the angles that you can see in the lady on the profile. So, which are main aesthetic demands in Caucasians? But, of course, mimetic disorders remain the first, but skin radiance, mid-face volume loss, especially in a little bit older patients, baby boomers, lower face laxity and tissue laxity, nose and skin enhancement, pigmentation disorders, very important, and neck wrinkles. The first always remains the mimics and the superficial wrinkles that you can improve not only with botulinum toxin, but with biorevitalizers, and ZTF, one of the first. Skin radiance also is very important, the volumes, but also fourth, the laxity of the tissues, that is one of the most important concern in Caucasian ladies. And how to correct? We already saw all the weapons that we have in our arch. Maybe for the volumes, the universal, that is one of the most easy materials in our portfolio, but also BioNutriLift, all the protocols that we have. The improvement of superficial wrinkles using, for example, this new device that is NanoSoft. The peelings that also, in my opinion, are very nice, very useful, very light, but anyway very effective, with not only one session, but in a few sessions more. And then skin perfusions, the serum, the boosters, and the creams that are so important. Time peel, for example, in this lady I used, the lady that you saw, is very safe for sure, but with also light glycolic acid, pH 1, and some little characteristics, is very useful, for example, for the little hyperpigmentations. You saw that Ricky used it also in high phototypes, and this says everything on the safeness on the peeling. Doesn't burn too much, and so, in my opinion, a very good possibility that many times we don't remember. But superficially, the improvement of the skin in Caucasians is fundamental. The mesotherapy technique, this is the YED technique, not please the nappage. This is a YED technique, and very useful, born in French. You remember, the mesotherapy is a typical French technique, nowadays diffused all over Europe, and the use of NanoSoft, that is also a very important possibility that we have in our arch, that gives you the possibility to remain really in the basal membrane, where NCTF is really effective, where there are the fibroblasts that are the target of, main target of NCTF. And of course, another fundamental part is the light volumization that you can get with volume, but also maybe with universal volume, is the perfect, very easy to inject reference that you can inject with a 27 needle without any problem. And very quickly, I wanted to underline how much the lips are important in Caucasian patients. And the new reference, not so new, but anyway, the last reference, LipSoft, that is so perfect in this patient, that where I used to improve slightly the volume, to improve the very superficial wrinkles, coat bar wrinkles, that are so important for these patients. Using in this case BioNutriLip, so using NCTF and LipSoft to get a light volumization. And here you see also you can use this to underline a little bit the filter columns and so on. And with very nice results, very natural, like this lady asked me to get. Please, doctor, totally I don't want that anybody can see the results. And so naturalness is very important, and with Fillmed products you can for sure get. So the typical treatment in my clinic, my typical proposal, my typical protocol is in autumn, winter peels, time peel in this case, NanoSoft, the usual 5 sessions that are so important to get results, not one session, but at least 3, but better 5 sessions. Light volumization using, in this case, universal volume and Live Soft, and then finally the home care with skin perfusion products that honestly I use also in my clinic. So in summary, the main problems in Caucasians remain skin, light, little hyperpigmentations, proportions different from Asians and especially Africans, volumes, especially malar area, sometimes nose, nasolabial, and lips that are so important, especially in the young ladies, to improve them, maybe with lip, but especially in this case, in baby boomers with lips soft. So thank you so much, and I hope that all my colleagues will arrive will reopen their and we see if there is maybe any last questions, but we already answered to all the questions and we are a bit late. Maybe any underline. I had one question for Ingrid, also for her, because the question on the feminilization, and so in the men, was from Jorge Moreno, was for you. And so, which is your way to avoid the feminilization in men? Ingrid.
Yes, in the malar area is the same thing that Ricky explained very well. So, but it's not only the malar area, it's also very, very important to remember the forehead, the central part of the forehead. We need to avoid applying a lot of volume there if we don't want to feminize, and also the chin. The chin is very important because it's a very big difference between females and males, so we need to be careful. In men, we need to apply more lateral, so 2 points to have more square chin, and in the female cases, we need to apply in the central part to give more anterior projection, or also if we want to elong the face. So this is on to see the whole face. Is the central part of the forehead, is the temple very different between females and males, so is the square part of the masculine treatment of the cheekbones, and also Ricky explained us we need to see the angles between the mid-face and the maxillar bone. So this is all the face what we need, because there are few little changes that are very, very important to avoid feminization.
Very good, thank you. I see that there are still a lot of doctors connected, and I have a question. My opinion, when we do a peeling, how much time you use from the peeling to the next session? Normally, me, I use a lot pills. I prefer to do first pills and 15 days later revitalization, 15 days later peel. So the pills every month, and in the meantime, in the mean part, also revitalizations. Ricky, your way in towards?
So if we think of the Fillmed peel specifically, it's a superficial peel. So it means it improves the cell turnover. So it makes sense to say that you're going to do it every 28 days. But sometimes we do want to overstimulate. So you would do maybe 2 weeks later. But then you need to make sure the patient has got a good barrier. So it's usually a more thicker skin, oilier skin, with maybe something like acne or some texture problems. Then sometimes we interrupt at 28 days and we do 2 weeks later again. You can even do a week later, but it should not be done in sensitive skin. So the answer is that you really need to adapt it according to the skin type. But with Fillmed going really past the basal membrane ever, it's quite safe to tailor make your protocol. Okay?
Thank you. I wanted to finish around the world this question because it's very important, in my opinion, on the feminization of the male. And so I ask Bilan, in Asian, this is very important because Asian men must be stronger, as you said, and sometimes they are very kind in the face. And so the feminization, in my opinion, is more important, can be a problem in Asians more than in Caucasians. How do you avoid this problem?
So as I presented, Eliseo, I don't think there's a right or wrong answer as to whether one should feminize the look of a male patient, because it depends on the needs of the patient. There are really a lot of K-pop culture, a lot of Asian men that I see, they actually want to feminize their look. So in those that want to look a little bit kinder and more feminine, then we will do the fillers the way that we will do it on a lady, but of course with less of the feminizing features. But in a gentleman, as shared by Ingrid and Vicky, male features require male attractiveness, require very strong facial definition. So for Asian men, typically we want to make sure that the proportion is 1:1:1. The cheek shouldn't be full, the cheek should be flat, even if they have got volume loss in the media malar region. Even though if their nose is really high, I will not give my gentlemen, if they want to masculinize the look, a very full cheek. Definitely, I will add filler to the zygoma. Okay, definitely, I will give them a very strong jawline and a very square and box-like chin. Obviously, the width of the chin is the width of the oral commissures. Not like the ladies, the width will be a little bit smaller, the width of the base of the nose. And as I've mentioned earlier too, if you don't want to feminize the look of the gentleman, besides all these very strong features, a flat cheeks, a flatter forehead, the temple, it shouldn't be too full, a high cheekbone, strong jawline, you want to give them the mandible, as what Vicky has mentioned, the same width as the zygoma. The lip should be neutral position. You don't want to give them upturned lip because that will give them a joker smile, and that's not nice. And for males, you also don't want to give them a fuller upper lip. If their lips are thin and wrinkled, generally we don't give them a very thick lip filler. You want to give them a very soft filler just to hydrate and to get rid of the lines and to give them some definition. So I think in Asia, depending on, generally the gentlemen want to be feminized, so we will give them very strong features, as I've mentioned earlier. And in those who really want to look a little bit softer, we will not give them a very strong definition of their facial features.
Thank you. Ingrid, quickly, which filler do you use for the forehead and why?
Yes, in most of the cases I use fine lines because we don't want to give a lot of volume in most of the cases. We need to remember that, for example, in my case that I show, I use it universal and then the temple volume. So we always need to have a good proportions between the forehead and the temple area. So if you use, for example, universal for the forehead, then in most of the cases you can use for the temporal area universal. So we need to understand the proportions. But are both very, very good. If we want to volumize, then I usually use universal. And if I want to enhance the lines and to have, to give a natural result, so fine lines is really nice to use there.
Yeah, Patricia, Mendes asked you, and of course, I totally agree with Ingrid that there are many different indications. Volume, volumization, universal is also my best product, and few superficial wrinkles where I underline that with art filler fine lines we can get an incredible result. Ricky, your opinion? Ricky has
Can you hear me?
okay, now I hear you, Ricky.
Okay. So I prefer fine lines. I have really very good results of fine lines on the forehead. And I've been using it a lot more, especially for patients that really starts getting heavy brows, but forehead wrinkles, because the older the patients get, the less we can use botulinum toxin and frontalis. So for those patients, I say really to do at least once a year, fine lines in the forehead, and really it reduces the need for botulinum toxin in the frontalis area. And I really try and suggest that once a year, at least for my patients.
And which technique? Linear retrograde or point by point? Ricky.
I prefer a cannula because there's a lot of bruising. It's not very safe. I use a 25 gauge cannula, so that's my personal preference. And then I try and go in the wrinkles, but I actually do like a fan, like your BioNutri-Lift, like a fan in the forehead.
Yeah.
So it's not that you fill the wrinkle, it's almost like you give the dermis like a cushioning, that you want to strengthen the whole forehead area. So I don't follow only the wrinkles, I actually fill up the whole forehead so that it's almost like you're giving a pillow that became soft, you make it full again.
And how can you remain so superficial with cannula that I think you use, like me, 25 gauge, the BioNutri-Lift cannula? How can you remain so superficial?
So I basically put my cannula in, and then if this is your dermis, you go in with a cannula, and then you try and push it against the dermis, and you leave almost like you make papules from underneath. So it's a technique that I started doing, and I get such good results by really pushing the tip of the cannula against the dermis and making small little papules. So it's almost like you're doing a skin boosting from underneath with a cannula.
Of course, totally your experience,
Yes.
not supported by Fillmed. And you, Ingrid, which is your best technique?
Yes, I also used to do with the cannula. This is my personal experience, but it depends. In some cases, when you are using universal, you can apply, for example, also with the cannula, but the layer is different, because with fine lines, you can be subdermical, like the Ricky technique she explained. But if you want to treat with universal, you need to be sure to be on the bone. You need to remember that the frontal muscle is really thin. So one part, if you your point of entry is on the crestal area, so it's easy. If you have a 90-degree point of entry, then you can go under the muscle and apply your treatment. I prefer to use 2 points of entry, and in some cases, if I want to give more volume on the central part, then I apply in one technique, in a fan technique in the central area, but it's not in all cases, only if we really need to have volume in the mid part of the face. So if not, I prefer to use 2 entry points on the lateral part of the forehead.
I totally agree with you. If I have to say my opinion, knowing much more this new device that is the NanoSoft, that has 3 little needles, 34 gauge, I follow this with the free needles this way, and if you push a little bit more to get a little bit more deftness, you are able to feel these wrinkles in an incredible way. So I suggest all our colleagues that I still see are all connected from all over the world to try this technique, not with the needle this way, of course, but with the needle this way and following all the line, not here and here and here, but very well done. You can get an incredible result without giving volume. So if you want volume, of course, cannula is incredible, but NanoSoft is incredible also here on the forehead. Well, I see that there are no other questions so far, and so I want to thank all of you. Ingrid, thank you for now you are very active. I see that quite all the questions are from Latin America because it is very early. It is morning, and so you wake up and you are very, very effective. And thank you, Ricky. Thank you also, Bilan, because I know that you are in Far East and it's very late for you. Thank you to be here, and I hope to see you on site very, very often, very, very, very early, in a very quick time. Okay. Thank you to all the colleagues from all over the world. I see that still now there are a lot of colleagues. I invite you to all the webinars that Fillmed company organizes. Very, very interesting. And before leaving the chat, please leave one comment, a critic, very, very, very appreciated. And also, if you think that it was a good webinar, interesting, leave your comments on the chat. They will be very, very appreciated. Thank you. I see that also the webinar, I had a doctor that asked if it is possible to see it tomorrow or later on. All the webinars will be registered, and so it will be visible. Connect with Fillmed and ask the ladies in Fillmed how to see the webinar. Thank you so much, everybody. Ciao, Ricky. Ciao,
Thank
Ingrid.
you, everybody. Bye-bye.
Thank you. Ciao. Also, thank you to Natalia Sukmanskaya, Amelie, that is not Amelie, but now I don't remember. Annalise, thank you so much.
Thank you, Natalia, Annalise,
and thank you.
Ingrid, Bilan.
Thank you all. Ciao. Bye-bye.